So typically we admit a patient for atrial septal defect closure a day prior to the procedure, and when we admit the patient we do an anesthesia checkup and blood checkup to make sure there are no infections in the body at the time the procedure is to be done, and that other organs like kidney, liver, all those are working properly. And once those are cleared, next morning we take the child fasting at about 7:30 or 8 o'clock in the morning to the place which is called the cardiac catheterization lab. And once we enter the cardiac catheterization lab, one of the first things that we do is we induce general anesthesia, by which the patient actually doesn't know anything that is going to be done and feels no pain. These two things are very important for us, that the child should not have any traumatic memory about the procedure, and secondly, at no stage should have felt pain, because pain is something we want to avoid in all children at all stages, and this is a priority in our team. Once the general anesthesia has been induced, we pass an echocardiography probe into the mouth and into the food pipe. Once it enters the food pipe and the heart are very close to each other on the back side. From there we can see the atrial septal defect very clearly, and it is there and through those images that we measure the exact size of the atrial septal defect, and it is then that we decide what device size we are going to use. This whole process of going inside the lab, closing the hole, reversing the general anesthesia and coming out takes about 2 to 3 hours. But the exact time of the procedure, that is from the time we put the IV line to the time we remove the IV line, it takes about 1 hour. The exact amount of fluoroscopy done during this whole 3-hour procedure is somewhere between 7 and 10 minutes, typically when I do the procedure. And that is exactly how long it takes us to do the procedure in various measurements.